this is a really interesting story. I mean, I read this piece and I was not surprised. Okay, let me tell you, Anne, that when the Healthy People's 2012 or whatever that was that came out from the advisory committee at the Department of Health and Human Services and at the CDC decided, they came out and they wrote this, that they wanted a 90% or more, a greater rate of healthcare workers. And not just healthcare workers. We're not talking about doctors and nurses. We're talking about janitors and people that work in the laundry and the cafeteria and the IT guys that are off campus where there's no patients. All these people are being forced to have flu shots. And I said, well, these guys are first. Then it'll be teachers. First it'll be school teachers at schools that get federal dollars, so public schools, public preschools, and then it'll go to city workers and federal workers, city workers, state workers. It's going to be eventually it'll be you can't go in public. You can't go shopping in the grocery store. I mean, I'm kind of making it sound Orwellian, but I actually think that's where we're headed. And let me just tear this apart for you, because I know many people getting their master's or their PhD or med students or residents, and they're being told they have to get the flu shot or wear masks, and they're opting to wear masks. Okay, so let's talk about that for a second. You wear a mask. You wear a mask all winter, even though you don't have a fever, you don't have sneezing or coughing, you don't have a runny nose. Why are you wearing a mask? There's no contagious, you're not contagious. And on the other side, you can get a flu shot, and as we know, and we'll talk about this year's strain, but you can get a flu shot, and what's the percentage of people who get sick in the winter who actually have influenza anyway? It is such a small percentage. At any winter, 7% of the population are diagnosed with quote-unquote flu, which means a flu-like symptom, an upper respiratory symptom with coughing, sneezing, fever. It does not mean influenza. Out of that 7%, only 7% of those people actually have influenza, right? So it's a small percentage. There's all these other things going around that can knock you on your back and make you sick. So people who get, the workers at these at the healthcare industrial complexes, which I'm calling it these days, they go ahead and get the flu shot, and then they have fever and they're coughing and sneezing, and they don't have to wear a mask. They're clearly contagious, but because they got the flu shot, they're not forced to wear a mask. Now think about that for 1 minute. And then let's fast forward to the news last week where the CDC says, we've been looking at the H3N2, which is one of the strains that are covered in the flu shots every year. And it's one of the serious strains. It's one of the strains of influenza that actually does get people, if you're hospitalized, it's often, aside from H1N1, the H3N2 is one of those strains. Well, they've been, looking at these strains, and guess what? 52% of them are not covered in this year's flu shot. 48% are, 52% aren't. Which means over half the population who got the flu shot are not going to be protected at all, whatever protection the flu shot gives you, which is also, we can talk about that, it's a small percentage. But they won't even be protected for the right strain of the serious influenza. Are they going to be forced to wear a mask? And if not, why not? I mean, my point is that mask wearing is punitive. It has never been shown to be effective for people who aren't acutely sick and shedding viruses. If you're just walking around, it's just interfering between you and your patient's relationship. Can you imagine doing a psych evaluation or doing a therapy session where you've got a mask on and you're not even sick, and your psychotic patient has to watch you with a mask on your face? But yet your colleague could have taken the flu shot and now have fever and coughing and sneezing and spreading viruses, and they don't have to wear a mask. So we know that this is just punitive behavior. It has nothing to do with shedding viruses and keeping patients healthy. Because so far, the large Cochrane studies on looking at, do we see decreased flu-like symptoms or flu-like diagnoses in the hospital or in nursing homes, are they reduced when healthcare workers get the flu shots? And the answer is no, they are not reduced. So we have a lot of things that are punitive in terms of if you don't do what policy is telling you, and it's just to harass you. There's no rationale behind it. And now we've got preschool teachers being told in this one instance that they're going to have to get flu shots. And this is just the beginning. And what people don't realize is that, there's no state mandate. There was a state mandate that was attempted in New York, and the New York Nurses Union challenged it and was going to take it to state court, and the state backed down. You know why? because they would never win in court with a jury with evidence. There was no evidence to support this. So instead of making these statewide mandates for flu shots for healthcare workers or teachers or whomever, what they've done, at least in the healthcare system, is that if you get whatever the percentage is, and I believe it's a 90 percentage, if you get 90% of your workers at your medical center with the flu shot, if you can get a positive rate, you get a certain amount of federal dollars. So there's an incentive, it's incentivized, and there's a big cultural pressure to say, oh, it's not worth it. I don't want to walk around for 4 or 5 months with a mask on my face. It's not worth it. It interferes between me and my patients. Or if you're an IT guy, it's like, well, I don't want to sit around with a mask all day. So there's a lot of conflict, but it's really all about conforming. It's all about conforming to the social norm and doing what's best for pharma, as usual, because this really isn't what's best for patients. It's never been shown to be what's best for patients. Hand washing makes more sense. Not wearing the same tie and the same doctor coat over and over, again, is also great because we know that those things carry lots of germs. And so hand washing and maybe wearing a mask for when you're acutely ill, whether you've had a flu shot or not. That would make sense. Let's do something that makes sense, but that's not what's going on here. It's a lot of nonsense.